Doctors could be on the brink of a breakthrough.
Migraines.
How to control them. Tame a migraine.
A severe migraine.
Throbbing, recurring headaches.
Given all the noise, navigating the migraine experience can be confusing and scary, but you do not have to do it alone. Welcome to the Migraine Guy Podcast, the official podcast of themigraineguy.com and theheadachereview.com. Now, here's your host.
What is up, fellow migraine sufferers and warriors? It's Kevin here, the Migraine Guy, bringing you another edition of this week's podcast. If you're new to the pod, thanks for checking it out, and I hope you'll hit that subscribe button. And as usual, if you're listening on iTunes, I hope that you will leave a 5-star review with some kind words about why you like the pod. This week's pod's going to be a little different. We're going to do a little bit of a throwback. There's been a lot of stuff in the news recently, as well as lots of questions that have been asked of me about the opioid crisis as it relates to certain migraine sufferers and other headache condition sufferers like cluster headache sufferers who need and rely on opioids for basically their survival, their ability to get through their day-to-day and misunderstandings that they've been trying to deal with, especially when it comes to getting their prescriptions, sometimes that they've had for decades, 20, 30 years, denied by pharmacists or denied by insurance companies because of the opioid crisis. And there's lots of misconceptions out there, lots of people suffering that needn't suffer, people who are doing better with medication who are now finding themselves unable to get their medication, and in some cases going to extreme lengths to stop the pain, because chronic pain is certainly nothing people really understand unless you live with it. So that being said, we're going to do a throwback to the podcast that I did that went into the opioid crisis pretty thoroughly, and most of the stats and figures have not changed, so it still is relevant content, but I thought I would just reach into the time machine, grab an older podcast, and bring it back for newer listeners. So that's what we're going to be doing this week. If you are already very familiar with the opioid crisis as I understand it and the way that I explain it, then next week we will get back to a regular podcast. So if you're new to the pod, I hope this is informative, and if you're a continuing podcast listener, I hope you get something new out of this old content. That being said, let us get started. First things first, of course, I am not a doctor. I am not a researcher. I am not a medical practitioner. And so all of the stuff that I am going to be talking about will be footnoted in the show notes below. If you're not familiar with show notes on a podcast, whatever platform you're listening to, just scroll to the information section about today's podcast, and you'll find all of the links to the articles I am going to be using to inform my discussion of the opioid crisis today. And of course, if you have stuff that I am not citing, stuff that is contrary to what I'm saying, things that I am ignorant of, please hit me up on social media, link me those articles, let me know, just hit me up. It's the Migraine Guy on Twitter, Instagram, Facebook, and YouTube. Just let me know if I am missing something. I definitely do not want to be putting out bad or false or irresponsible information. And so if I am, please call me out on it. I appreciate that. But I think I've done my best to get a well-rounded picture here. So, why discuss migraines and opioids? Well, chronic pain conditions like migraine can very often be supplemented by prescription painkillers for severe cases. The stereotype that only end-of-life patients or post-surgery patients as the only cases where patients need painkillers is grossly understated. You know, when you're a migraine sufferer and the triptans or the ergots or the NSAIDs or the prophylactics don't work, there is very little left that a migraine sufferer can turn to for regular and reliable pain management. Prescription painkillers are just what they say they are. They are painkillers. They stop the pain. They're meant for patients in a condition untreatable by other available medications. Many migraine sufferers find themselves in this particular category. I know many in my Facebook support group, the Migraine Guy support group, who have as a supplement to their overall pain treatment plan, their migraine treatment plan, or as their primary source of pain management, opioids, prescription grade opioids. And it's just part of their daily life, and without them, they would not be able to function. So this definitely speaks to at least a proper subset of the migraine community. Of course, if you Google opioid crisis, 9.5, 9.9 times out of 10, the first paragraph of whatever you're reading is going to say the exact same thing, and it's going to report on death rates. It's not going to talk about the opioid crisis, it's going to talk about death rates. And death rates are actually about an overdose crisis, not necessarily the opioid crisis. They're not the same thing. Overdosing is not the same as addiction. You can overdose on your first time of doing anything, and you can be addicted to something without ever overdosing on it. They're not the same thing. And yet, this is what gets conflated by the media, our politicians, and many of our health care providers. They don't recognize that there's a distinction to be made. So we need to make this distinction clear. So I'm going to get some quotes out here from some of the articles that I'm reading from, and I'm using the quotes because they are just summarizing a lot of the statistical data that I am relying on, and I'm going to be using some of this data to answer some basic questions about the crisis that you may have. So question one that we're going to want to answer is whether or not non-medical use of opioid analgesics such as oxycodone and hydrocodone have been on the rise or on the decline or have stayed the same over the last number of years. Well, according to the National Survey on Drug Use and Health, the NSDUH, non-medical use of opioid analgesics such as oxycodone and hydrocodone peaked in 2012 and has since dropped below the rate that they were used in 2002. Although the recent decline in prescription painkiller use was accompanied by an increase in heroin use, the total opioid use was still lower in 2014 than 2012, end quote. So what that points to is that the overall non-medical use of these opioid analgesics like oxycodone and hydrocodone that you hear a lot about have actually been declining in usage, at least in non-medical usage, the kind of quote-unquote recreational usage that lots of people talk about, the kind of, maybe teenager, 20-something who has access to a parent or a friend's medicine cabinet who has the pills for a particular pain issue and takes them to a party or something. That kind of use overall has been on the decline and is actually below the numbers that they were 15 years ago back in 2002. The second question we're going to ask ourselves is, according to the statistics that we have on hand, are opioids solely responsible for the overdoses that we hear about them being responsible for? The answer, again, might surprise you. Despite the decline in use that we just noted, opioid-related deaths reported by the U.S. Centers for Disease Control and Prevention, the CDC, says that the amount of deaths did continue to rise through 2014, despite the reduction in overall use. There were roughly 29,467 opioid deaths in 2014, which was a record number. The interesting fact here to keep in mind about these opioid-related deaths is that they were related deaths. An overwhelming majority of such deaths, more than 9 out of 10, according to data from New York City, involved a mixture of opioids with other drugs rather than simply straightforward overdoses with a single drug. And this is extremely important to keep in mind because opioids rarely are just overdosed on their own. According to the data that we have, they're very often accompanied by large amounts of alcohol. And if the opioids themselves are heroin, if the opioid itself is heroin, that heroin is very often cut, very often mixed with fentanyl, a very common synthetic opioid manufactured in either China or Mexico, apparently, are the two big places where they're illegally manufactured and imported to the United States. And fentanyl is not only very dangerous, it is also much more potent than most of the opioids that we have on the market. And so, your average drug dealer, your average guy, selling stuff on the street, guy or gal selling stuff on the street, isn't worried about properly titrating the amount appropriate to the body mass of the individual they're selling to. They're simply giving out the same thing to everybody. And so if someone's going to overdose lots of people are going to overdose. And if lots of people are going to overdose, it's going to be because a variety of things in their system are present, some of which are going to be opioids, some of which are going to be other things. And this is just the reality of the situation. So opioids certainly are involved, but they are not the only thing solely responsible. But they're the only thing being highlighted as the contributor to the amount of deaths that we just cited, the nearly 30,000 deaths that we just talked about. And so it's just very important to keep in mind that opioid-related deaths are related deaths and not solely caused by deaths. Additionally, the CDC says healthcare providers wrote 259 million prescriptions for painkillers in 2012, which was roughly enough for every American adult to have a bottle of pills. Here's the important part. That year, the CDC counted about 16,000 deaths involving opioid analgesics, which translates to about 1 for every 16,000 or so prescriptions. So for every prescription written, for every 16,000 prescriptions written, 1 would result in death. And that number translates to a very, very low likelihood of overdose or addiction associated with overdose in regards to opioid analgesics of the kind that we've been talking about. Moreover, opioid-related deaths are rare even for patients who take narcotics every day for years. The CDC cites a recent study of patients aged 15 to 64 years old receiving opioids for chronic non-cancer pain who were followed for up to 13 years. The researchers found that 1 in 550 patients died from opioid-related overdose, which is a risk of less than 0.2%. End quote. 0.2% for long-term use. 1 in 16,000 prescriptions. All of these statistics should be somewhat alarming because while every single death from medication is sad and regrettable and has probably harmed the families to a certain level that we'll never understand, harmed the friends to a level that we'll never understand, the point is that this does not elevate it to the level of crisis. This does not mean that the kind of reactionary politics, the reactionary pharmaceutical policies that have been implemented over the last couple of years that are now denying genuine chronic pain patients the medications that give them a quality of life and are forcing them to take drastic measures, which we're going to get to in a minute. That does not mean that the chronic pain patient being denied is justified because there is this horrible crisis going on. The crisis is very, very nuanced, and it is not something that can just be talked about in general terms and broad brushstrokes. It needs to be discussed with very, very fine-tuned tools. It needs to be discussed with precision. And the point of me highlighting these statistics is to break some of the kind of basic conceptions about the crisis that we have. It doesn't seem like the average person who takes an opioid becomes addicted or overdoses. It seems like the person who does overdose doesn't overdose simply because of the opioid. They overdose because they're taking opioids in conjunction with other drugs. The average person who becomes addicted doesn't become addicted because of the nature of opioids. They become addicted because of the nature of addiction. Let's turn to what addiction's nature is. According to the NSDUH, of the 259 million painkiller prescriptions in 2012, only 2 million cases resulted in dependence or abuse, basically 1 for every 130 prescriptions. A recent study by Castlight Health estimated that roughly 4.5% of people who have received opioid prescriptions qualify as abusers, though they did admit that its definition was slightly too broad and probably captures some legitimate patients as well, and so the number of 4.5% is probably too large and should be smaller, but we can stick with 4.5. What that means is, of course, that 95.5% of people who have received opioid prescriptions would not qualify as abusers. And so the threat, the fear that being prescribed an opioid is going to turn you into a chronic user of it, an addict, or is going to result in your overdosing on it, doesn't seem very well established, at least statistically. Certainly, any single person who has experienced addiction, or who has seen someone go through addiction, or has seen someone go through an overdose and die, is going to be horribly scarred by that situation. And what I'm trying to say is not to overlook or downplay the horrible events that go around losing someone, or watching someone go through the many phases and stages of addiction and being lied to by that person, or being told one thing and then having stuff stolen so that they can sell it for drugs. I've had friends who have gone through this. I've had friends who have successfully gone through it, i.e. have gone through it and gone through rehab, and have built a life for themselves, and others who haven't and have died. And so I have seen both sides of this coin, and I certainly do not want to be read as downplaying the side of the coin that is associated with loss, because anytime anybody dies that you care about, it is horrible. And that is just true of the opioid crisis and any other circumstance. The point is that the way that opioid abuse, addiction, and death is described, the way it's being treated in the media, the way it's being treated by politicians, that means the way it's being treated legislatively, the way it's being treated in our pharmacies, is reactionary. It's not being based on scientific principles. It's not being based on fact. It's not being based on statistics, because the statistics I'm citing are the basic statistics. I've tried to find all of the statistics that I can from the CDC or other government agencies, because they're the ones that set the basic ground rules at the federal level. They're the ones that are making the large scale rules that are setting the rules that then get translated into state rules, that then get translated into local CVS and Walgreens rules, right? They're the ones that are collecting data that is supposed to be influencing proper legislation. But the idea that there is this big crisis going on that needs to result in a 180-degree turnaround, a huge restriction on opioids, I just don't see being based in the stats that we have discussed so far. Moreover, among those for whom opioids are prescribed, the onset of addiction is about 10% for those with a previous drug use history. Moreover, it's actually less than 1% for those with no such history. Those are stats that, until I was actually researching this podcast, I had never heard before. And I'm, of course, going to put the links to this data in the show notes below, so that you can look them up yourself and verify them yourself, so that it's not just me making stuff up. But the idea that addiction, right, because these are stats on addiction, the idea that addiction is something that can just spontaneously occur when you're exposed to a certain substance is pretty far-fetched. Addiction is not only a biochemical process, it is a psychological process, right? Addiction is the kind of thing that, for example, something that isn't talked about a lot in the media or by our politicians, is highly correlated if you've had adverse childhood experiences, ACEs, ACEs. We've talked about this before in relation to other aspects of migraine prevalence. And ACEs, adverse childhood experiences, are defined as stressful or traumatic experiences, including abuse, neglect, and a range of household dysfunction, such as witnessing domestic violence or growing up with substance abuse, mental illness, parental discord, or crime in the home. These kind of experiences are highly correlated with substance abuse later in life. And not just substance abuse, but addiction. My point in bringing that up is that I don't ever recall coming across that kind of deeper analysis in any of the basic kind of news or political discussions about the opioid crisis that I have been able to recall. The typical things that I hear about are that, well, basically the character of the person who is addicted or overdoses is faulty. Sometimes there is a bit of sympathy for the person who overdoses or is addicted, and very often that means that blame is placed on the pharmaceutical company or the doctor, and sometimes that blame is rightly placed. Sometimes pharmaceutical companies are surprisingly greedy, right? Who would have thought that? Sometimes blame is placed on doctors, and very often, I'm not going to dispute whether or not that blame is rightly placed. It certainly is right sometimes. The point, though, is that I rarely hear that an adverse childhood experience of the kind that we've been discussing could be a large, if not dominating factor in addictive behavior. Now, what that means is that if we want to prevent addictive behavior, we need to be heavily invested in making sure that the next generation is growing up healthy. Not just healthy in terms of diet, but healthy in terms of family structure, healthy in terms of school and education, healthy in terms of all the various things that we care about, after school activities, before school activities, if that's the case, if both parents work, that they have access to giving their child good daycare. All of those kind of things are the kinds of things that will go into preventing adverse childhood experiences from giving rise to future addictive behavior. But you never hear any of that when it comes to substance abuse, or specifically opioid abuse. It's always that addiction is a choice, and that addictors, people who are addicted, have some sort of character fault. At least the stuff that I've listened to. Maybe I've only listened to the most negative of the negative comments. But at the very least, I have not heard this emphasis on our needing to focus on the upbringing of all of the children in order to prevent future substance abuse problems like opioid abuse. But regardless of that, it does just speak to the fact that opioid abuse or addiction of whatever degree doesn't necessarily reside in the nature of opioids. It resides in the nature of addiction or overdose. And opioids, given the statistics that we've looked at, that right hand to God, I have tried my best to get the most accurate and reliable ones out there, don't seem to justify the claim that opioids really are the devil's work, that they're really this huge thing that we need to be afraid of. They have their place. Their place is for chronic pain or acute pain management. Now, there are some studies that are coming out that are showing that maybe for certain chronic pain conditions, they don't do the best work because they might actually exacerbate the kind of condition that they're being used to treat. And that is perfectly fine, of course. If you're a migraine sufferer and taking a particular opioid is going to help short-term reduce the pain, but long-term might introduce some kind of rebound headache, that's going to be worse than you would have had otherwise. Maybe that's a reason to consider not taking the opioid. But that's a very different conversation than opioids are going to kill you, or opioids are going to get you addicted, or opioids are going to ruin your life. And that's the kind of conversation that we're having right now. That's the kind of conversation that Western society is having, that opioids are basically the worst thing you can get on. They're going to either get you addicted or you're going to accidentally overdose. And none of that really seems justified for most people. Now, as I've tried to qualify numerous times, there are some people for whom that is true, and I don't want to downplay the significance of those people. But for 90+%, at least given the stats that we've looked at, it doesn't seem like that's true. And so the fact that, the media and politicians are ignoring those stats just speaks to the fact that we need to be our own advocates. We need to be speaking up not only for ourselves, but for each other. I'm going to link in the show notes. I was a little hesitant to, clicked the wrong button. I was a little hesitant to read some of these stories from a Medium article by a doctor. I keep pushing the wrong button, I'm sorry. His name is Thomas Klein. He has a very active Twitter, and he started getting active on Medium. Medium's kind of a publish your own article site similar to The Mighty, where, you know, more popular articles get pushed to the top. Anyone can contribute. Some people get asked to contribute. Some people get paid to contribute. You can pay to get the service if you want, but it's free if you don't want to. Anyway, he has an article, which I'll link, that has a list, I think, currently of about 30 different patients who had chronic pain conditions of various kinds. None with migraine that were explicitly stated, at least, but various pain conditions, and had those pain medications drastically taken away. No, you know, even 10% reduction over time, as the CDC's guidelines currently state. But just 1 week you have it, 1 week you don't, even if you've been on it for a year. And every single person ended up committing suicide because the pain was so great that they were feeling day in and day out, and their pain medication was unable to be acquired because they legally were being prevented from getting it. The doctors wouldn't prescribe it because the insurance companies were denying it, or because the pharmaceutical companies weren't allowing it, or because the CDC or the DEA was saying you can't do this, otherwise you're going to lose your license. And so the patients were unable to get the pain medication that was allowing them to live a somewhat productive / normal life, and all of them ended up killing themselves. I didn't want to read any of the stories in there because many of them are very sad, so I'll just link to it in the show notes below, but you can read them if you want. And I would really encourage you to follow Thomas Klein on Twitter. He posts lots and lots of very interesting statistics about the opioid crisis. He is one of the very few medical professionals on Twitter who basically has devoted himself to combating what he takes to be bad statistics and bad policy in regards to the opioid crisis. So I would definitely follow him. He certainly has an angle. I'm not saying that there aren't people who couldn't rightly criticize him for certain things he says, but I think in general his perspective is one of compassion for pain sufferers and one of criticism about the kind of things that we've been criticizing on today's podcast, the kind of overgeneralizations and the kind of overlookings of certain statistics that need to actually be looked at. So definitely give him a look. I'll put a link to his Twitter in the show notes below. All of the links to the stuff I've talked about will be in the show notes, as well as much more of the detailed stuff that I didn't get into. And let's see, if you want to follow me on, you know, social media, hit me up on Twitter, Instagram, YouTube, and Facebook. Just search The Migraine Guy. And as usual, if you have any articles that I need to be looking at, anything I missed, this is a very complicated topic, so I don't pretend to have mastered it. I can certainly do a follow-up podcast if a lot of articles are pointed out to me that I missed. Just hit me up and let me know what they are. But until next week, everyone, I hope you have a good week, and please remember that regardless of your chronic pain situation, regardless of what you're going through right now, you are not alone. If you want to help keep everything that the Migraine Guy does free, then you can become a patron over at the website patreon.com. That's Patreon.com. Patreon lets people contribute funds to other people whose work they value. Becoming a patron does things for me, such as allowing me to buy new products so that I can do product review videos so that you know whether or not a given migraine product actually works before you buy it. It also helps me do things like upgrade the microphones and cameras for both the YouTube channel and this podcast. And more importantly, it helps me be accountable to you, my migraine community. You can pledge as low as $1 a month if you want to, and every single dollar does help. Just head over to patreon.com/themigraineguy to become a patron today.